Welcome to the Dr. Dana Show. Today we have two amazing guests. These are friends of mine, and I believe that it's been a predestined relationship how we met, because we'll talk a little bit about it. It's just something that probably would never happen, but it did, and I'm really blessed to have him on the show today. Raheel Ashraf is a chiropractor in New York City. He's got the coolest office on the 10th floor. It's right near Macy's in Midtown. You go in there, it opens up the hardwood floors. I think there's about 8 or 10 offices in there. He's got a small space in there. Doing the Wasabi method. He has a shockwave machine. He also has the Steven Schwartz vibe bed. So it's a really cool place to get a little respite, an hour. Don't bother with lunch, just go there and you'll be so relaxed when you get back to work. And Amir Khan here is a neuromuscular therapist in LA. And that's something I don't know that much about. So I'm very interested. And as we talked before the show, what came into my mind right away is you're like a PT for Alzheimer's and Parkinson's. Right? Yeah. I mean, because if you have those neuromuscular connections that are all, the neurons control those and they're basically not functioning very well, and you can do some kind of manipulations like touching somebody to get that to come back, like trigger points or something. I don't know. That sounds like really cool stuff I want to know about, because I'll refer to you. So first, tell me a little bit about the Wasabi method and what's that like. I mean, I have a shockwave machine, the Stores from Germany. How does it relate and what does it do actually?
So Wasabi method is a low-frequency shockwave therapy that helps to heal body without any invasive therapies. Like a lot of people that I used to work with when I was in the clinic, they were using laser, they were using Grafton, so people used to get a lot of bruisings. Like, for 3 days, it was painful.
That bad, huh?
It was really bad. And nobody knew how much to do. They always bruise more.
Too much for you.
Yeah, they did too much. So 2 years ago, me and Amir, we were at biohacking event, Dave Asprey, and we met the co-founder, and he partnered with Dave Asprey.
Wasabi.
Yes.
Okay.
So Dave Asprey came up with this name, Wasabi.
Oh, it's Dave Asprey's company.
Yeah.
Oh, I didn't realize that.
Yeah.
Okay, cool.
So he was working on his assistant, and she had this pain for 5 or 6 years in her hamstring. He did it for 5 minutes and pain was gone.
Wow.
So when she got off the table, she said, "It's spicy. It feels spicy."
Really?
And Dave was like,
Oh, wasabi.
Wasabi. And then the conversation was like, should we call wasabi? Then he was like, no, wasabi method, because we're going to do differently. The device you have, it's not class 1. Okay. Only medical doctor can buy it. So Dave was able to crack the code because he believed in biohacking. And we should have empowerment to use for ourselves. Like if you have any calf tightness, Achilles tendon, you should have freedom to go and treat yourself instead of like getting a prescription, go to PT, which takes a long time. That's how they came across. And then we were the first 2 people that we were using the demo devices and playing with it. And how is it?
Beta testing it?
Beta testing it, yeah.
Cool.
So once we approved it, they launched the company.
Well, I want to beta test it in my office. You guys
Yeah,
didn't tell me about that. All right, cool.
So it helps you with whole body soft tissue upgrade. Whatever you have soft tissue, we can apply it.
Explain to the audience what soft tissue would be.
A lot of the client that I get to see, they have shoulder pain, upper back tightness, Achilles tendon problem, like the foot feels tighter. When they plant, the calves are tight. I do have people with quad problem, so they have knee problem, but it's usually not the knee. It's the attachment that goes around the knee, because knee moves when the muscles ask them to pull. So I think I have like 3 older ladies, they're above 70. They were told they have arthritis, they have this diagnosis, and now I've been working with them for past 3 or 4 months. Mm-hmm. They're able to walk freely.
And what was their situation before they came to you? Were they in a wheelchair?
No, they were just walking slow, and they will walk like a block down, and they will see their muscle feel fatigue.
Oh, okay. Already.
And when you palpate the muscle and you check, they were hard. They didn't have any gliding.
It wasn't like tofu, huh? That's what they always said. It's supposed to be like tofu, right?
Yeah.
Not like a rock.
That's a good analogy. When I looked around it, I started working on the soft tissue. Mm-hmm. and a little bit behind the hamstring.
So basically, how does the Wasabi method work? It's a machine, right? It says
Yeah.
method, which is,
Yeah.
but it's a method with a certain type of machine.
Yeah.
And you're going to hold it like a tool on the skin, and it's going to, does it do the same boom, boom, like make that vibration like the stores does? Puts acoustic waves, but it's just a different frequency than the one I have in the stores
it's
model?
very similar to it, but it's just that's a different class, and Wasabi.
So the public can buy that one, and the public can't buy mine. Only doctor can buy mine.
Right.
Oh, I see.
Like for him as a neuromuscular therapist, or if someone is a personal trainer, massage therapist, like we use our hand all day, every day, and you get fatigue. So by the moment you have 6 or 7 person, you don't have the same flow anymore, unless you do Qigong, which is a different story. So now we are providing this tool. Once you apply a little bit gel and use it with the handle, it transfers the pressure wave down to the soft tissue, and it helps them to bring more blood flow.
And so less fatigue, right?
Yes.
So so neuromuscular therapy, what is it? What are you doing and how does it help people? Like,
You explained it pretty well, kind of like hands-on, manual manipulation of soft tissue and looking for the trigger points. And what I used to do is always use my hands. Like you're palpating the tissue, you're looking for the trigger point, the knots, the scar tissue with your hands, and you're trying to release it using Graston technique or other techniques. But after a while, you're using your hands or your elbows or whatever to release. It wears you down. And what I tell clients is like, there's parts of your soft tissue and muscle, the connection points, I cannot push hard enough to even get to it. Because like, let's say some of the muscles like pec minor that's attached to the ribs, the Wasabi method, the pressure wave is an acoustic sound wave.
What's a pressure wave? I don't understand that.
The device, the head of the device is going to send there's a technical term called mechanical transduction. So there's creating just a lot of energy at the tip of that device.
And this is like ultrasound energy or acoustic waves? Or?
So ultrasound, slightly different. It's on a different frequency. So we're using radial pressure wave. That's what's the technical term of it. But yeah, we use ultrasound gel to transfer the energy from the device into the body so that the transfer completes. And then we'll send that wave down. And we can change the power and the frequency to control the depth. So if you want it more shallow towards the fascia of the body or the surface layer muscles, or you change the depth where it can go deeper, where it's the attachment parts, where it's like connected to the bone, ligament, and the tendon. So when that wave will travel and it hits and vibrates those ligaments and tendons and those cells, the cells get jolted and they release all these biochemical neurotransmitters.
So is it like not ozone? What's the one where they use the sugar and they put it into the joint and they stimulate they make inflammation in the joint so the body goes there and heals it?
Oh, you're talking about PRP?
Prolotherapy.
Yeah. So
is it similar?
Microtrauma, but ours is non-invasive. Kind of a similar reaction because you're trying to create that minor irritation and you're invasive. This is completely non-invasive. This is why we're able to sell to a massage therapist.
Painful.
There is a level of pain depending on the person's tolerance. So normally we try to stay within a person's comfort zone. So on a scale of 1 to 10, try to stay around a 6 or 7. We can always control the power, and we know how to like direct the energy.
So you can start slow the first day.
Exactly.
And how many times a week would they have to come in on the average? Like
depending if it's acute or chronic. I've had cases where it was acute, and like one session they were done. But chronic pain might take a few more sessions just because of the time.
Okay, so say I had whiplash.
Yes.
And I can barely move my neck, and I don't want anybody coming anywhere near me. Do you have to wait so that gets a little bit less painful, or they have to take meds and then you can work on them?
So in a case like that, I always first ask them to check with their medical doctor, get cleared.
Say they're clear.
If they're cleared, then I can work on them if they have the permission from their medical doctor.
And you can do it so that you can start to get rid of the pain even though they're in such huge pain?
It will start to reduce inflammation. It'll start to increase the circulation in the area. Their mobility will start to...
Sometimes when you increase circulation, it gives more pain though.
Correct.
Temporarily temporarily goes up and then it goes down.
Because I know when I test my patients, I do like a little bit, and we have the very large metal tip. And that thing, it's really strong. So we can just barely do the very beginning. But after a while, once I start doing it, to me, I know this is what's happening, but it seems like it just numbs it out. and it's fixing it, so they can't feel it, and then you can go a little harder. But if you do too much, the next day they're going to have pain. So
that's why it's Wasabi method, because the method is the important part.
Okay.
We have to teach you the method so that you don't overshock someone.
Okay.
So there's a balance in all medicine.
But it's not
dosage.
shocking people, right? Because I've done it on myself. It's not a shock like an electric shock.
No, that's the word is unfortunate, but it's a technical term.
Stem wave.
Yeah.
That's what everybody started naming it. After I got my machine, I called it shock wave. It was like, no, that's stem wave. Okay, stem wave. That's fine.
Sometimes I swap it out with the word like acoustic pressure wave, just so that get that word, because sometimes even psychologically somebody hears
nobody
shock,
wants shock.
and they might just to saying it they get shocked.
Yeah. Oh, that's so cool. So would you be working on, so when you're talking about the neuromuscular work you're doing, is that, I'm thinking of fibromyalgia for some reason, because that's really hard to treat. It's about mitochondria, but it's still starting to come to the surface of the muscle, even though it's mitochondria, which is inside biochemically. So can you assist, like, so say I started fixing the immune system, fixing the gut, instead of all this autoimmunity, the body's not attacking itself, can you then assist in that? Would your treatment be an adjunct to that?
It can help. I don't know if Raheel has some more experience with fibromyalgia.
So I have experience with not just one, like multiple clients. When you have tight shoulders, you don't have a lot of blood circulation moving well. When you work with the clients and you move that fascia a little bit better, moving, clients are sleeping better. Like, I have a lot of text messages like, I don't know what you did, but I'm sleeping more.
Just treating this part of the body?
Yeah, like the upper trap or mid back, it helps them to get more flow. And that's what Wasabi or Shockwave does. It increases blood flow, circulation. And also, when you tell the body, like, this is where you need healing, all the chemical cascade will come up and start cleaning up. So you will feel a little bit tender, but in a couple of hours, it should just wipe down and you should not feel that sore. If you're feeling sore, it means something is happening in your gut, your diet is off, something else is off, then we recommend them to see other therapists and then we will take care of them.
Is there any other treatments besides musculoskeletal that you use it for?
We also use for erectile dysfunction because it helps to increase blood flow.
Sure. Does it break up fascia? Does it break up scar tissue?
Yes.
Yeah, because our machine is the one that it's really good for that. I didn't know if you can do it too.
But the tip has to be a smaller one.
Yeah.
And you have to maybe, put a little bit lidocaine on.
Yeah, I wouldn't put the big metal one. That would they would not be happy, yeah.
So a lot of people, they're using right now for ED, and now they're coming up with the woman and male health clinics now. I think we're going to be launching in May or June.
For women?
For men and women, because it definitely helps with angiogenesis, blood flow. And once you have more nerve fibers, everything active over there, you don't need a pill in order to, feeling amazing.
Do biochemistry 2 different ways. You know, for a lot of the women, as you get menopausal, it's a hard time having sex. It's painful, dyspareunia.
It helps.
And then they're maybe leaking urine sometimes, and I know it'll help with that.
Yeah.
So if anybody's interested in that, I know they have a lot of research on this. It's very, it can work really well.
Yeah, especially for women. I didn't know much about it. I recently I'm reading about a lot of papers that how, after birth, women pelvic floor can become a little bit loosened or they can become tighter. Yeah. So you can apply
It works with that, really?
Yes, it can help. For a woman, it's very hard to express their feeling. And according to the literature, and I spoke with one OBGYN, and she has been working with women for past 10 years, and she has amazing result because when...
Was they using the Wasabi method?
No, she was working with another company, and now she's going to be working with us.
But similar, okay, so that machine, okay.
Yeah,
nice.
Similar machine. And now for men's,
So let's stick with the women. So you're talking emotions? So you're treating vaginally with the machine, but it releases emotions?
So if you have ligamentous instability in your pelvic floor muscle, you will have constant pain in your lower back, or like you feel achy all the time. So it can trigger your emotions. So by releasing the pain, you can increase your feeling good hormones all day, every day. So when people feel good, they don't have pain, they're able to provide more to the family,
Oh, totally.
society.
Yeah.
So my goal in New York City is to have more energetic people around me. So when they go home or they go to work, they make a difference.
awesome.
That's the end goal,
really
right?
great.
For us to provide healing.
And so, will it help with wound healing? Do you know?
Because it helps to activate collagen around the scar tissue.
Interesting.
But if you also take collagen supplement, which recommended dosage is like 20 milligram a day, if you take collagen supplement or stem cell products and you do it, your wound will heal super fast.
That's really cool stuff. Yeah.
3rd-degree burn I have seen heal.
Really?
Yeah.
With just the wasabi or with exosomes or whatever?
With wasabi and topical exosomes.
Would you put the topical exosomes on and then you would do the wasabi method right
Yes.
on top of that
Yeah.
to enhance the efficacy
penetration.
of the, wow, really? It's like there's a substance, I used to get in my clinic and it had the glass was this thick, DMSO. And we, in the very beginning when I first started, because in naturopathic medicine, they taught you how to drive stuff in, the electrophoresis. I had a class like that. So I would mix the DMSO with like antifungal and we could fix the nails. One guy did so much of it. He said, you didn't tell me to stop. And he comes back and he didn't dilute the tea tree oil. Well, his nails were like disappearing. He used so much of it. But
Wow.
the fungus was all gone.
Right.
Yeah, it works very, very interesting.
So also when you help people to get rid of a lot of trigger points, or let's say they had some kind of injury they never healed because they just thought, it's going to heal itself. Even though when you remove it, you have to do something to reconnect them with their nervous system. So I add vibroacoustic bed.
Oh, nice.
With red light therapy.
So what is a vibroacoustic bed? Tell us about
So
this.
vibroacoustic bed is it's a bed that it has vibration in it, vibration. Right. Then they have binary beats inside.
What's that?
Binary beats send different type of, so you will have a headphones on and they have specific frequency that you listen that helps your brain to align. But this one with the vibration and the binary beats helps together.
Same time.
And then you add red light on top of this thing.
Oh, really?
If I have people pass out on the bed almost every day because they forgot what normal feels like or they forgot what relaxation means.
So they can completely let go.
Yes. Yeah.
And then the red light will decrease their inflammation.
Yeah.
So are they having better gut?
Yes.
Like the food, like digestion gets better. They can eat foods maybe they haven't been able to eat before. Maybe their allergies are getting better.
Yes.
Have you tested this though? Have you done allergy testing on them and seen?
We're friends Stephen Shorts.
Right.
So he did it. He has a friend. He had a cat allergies. After 2 or 3 sessions, the cat allergies were gone.
That's amazing.
Yeah.
Yeah.
So that's what he told me. But I have people tell me they don't get a lot of breakouts anymore. Because once the body is rest and digest, you can control your anxiety. They're always in stress.
Nervousness, stress.
Yeah. A little bit stress is good, but when you stay for a couple of hours, it becomes chronic. That's where all this inflammation comes in, and it just takes. Then it's a cascade of just from everywhere. Yeah. And then you blame God, then you blame your family, your neighborhood. Instead of fixing themselves, we're looking outside. I want this to be fixed. Yeah. So this whole holistic approach is so simple that some people, when I tell them, hey, let's do 6 to 8 sessions, I think you will be able to manage your stress better. For them, it's so good to be true because their medical doctor doesn't know about it.
In New York especially, the stress is high.
Yeah.
So you're saying you have them do the bed, the vibe bed, and you have the red light on them?
Yep.
And then when do you do the wasabi? When they're sleeping?
So first, once they relax, I can dig into the muscles a little bit easier.
Like when on the bed?
After the bed.
After, okay.
After the bed. So they do 20 or 30 minute session.
Okay.
And then I make them drink water because, you can become dehydrated. Right. So once they're back, they're feeling good, then they sit on the table. Then I check those muscles and you wouldn't believe 20-30% range of motion goes up just relaxing them.
Okay.
It's amazing how you can combine different modalities to heal one person.
That's great.
Yeah.
So I want to talk about one thing that happened when both of these guys were at my clinic a couple months ago. There was a patient there who had the ankle.
Yeah.
It's like a frozen ankle. It was from some surgery that hadn't been done very well. And she said she hadn't moved the ankle. It's like 30 years, literally.
Wow.
And we could move it like 15%. You could barely move it. And he just goes, oh, that's fine. We'll just take him to the shockwave machine. Just grabs my patient. brings him in there. I'm like, I got to see this. And he starts working on the ankle, but not just the ankle. He worked on the calf. He worked on the front of the leg, the calf, and Achilles. And he goes, okay, move your ankle. The lady's like this, like completely. And she's like, she's doing it. She's like, oh my goodness, what's going on? Like she couldn't believe it was her foot.
I had to stop her because she wanted to dance.
Yeah, I would not like. I knew the machine did really cool stuff and it was helpful. But when you showed me that, I was like, this thing's like a miracle.
Yeah. So this is one of the example. Like she had problem in the ankle, but it built up to her calf and quad.
Okay.
Because
you release something to release the up higher up to release down below.
Yeah. So I had to open the whole channel.
Okay.
So we work with fascia. So if you look at the muscles, the fascia is embedded in the muscles.
What is fascia exactly? What does it do?
So when you have you ever slaughtered a chicken or something?
No.
So when I grew up,
no, like the white boy in California, United States.
So once you remove the skin, right under the skin, there is a thin white layer.
Okay.
It's fascia.
Okay.
All those muscles are gliding because fascia is helping them to glide better. If the fascia gets stuck or muscle have any local trigger points, so it have some kind of hit, it will build up a little bit of trigger point.
Mm-hmm.
Once the trigger point is there, it's going to limit the function of the muscle. So let's say if something happened to your bicep, by limiting your bicep, you're also limiting your shoulder or your forearm.
Because you start favoring it?
Yes.
Yeah, okay.
And your brain think, oh, I can't go there.
Mm-hmm.
So it just holds you right there.
Oh, wow.
So now you're becoming in chronic habit.
Yeah.
So by releasing sometime one trigger point, it can open up the whole arm. And
that reconnects you back to the nervous system, or do you have to do more work after?
then usually within 48 to 72 hours, people will feel wonderful, and then they will start feeling the pain again. And psychologically, the first, is he going to come back again? I have to go see him again.
Yeah.
So we recommend people to come in, if it's chronic, come twice a week for like 2 or 3 weeks, so we can manage if pain is creeping up again or not.
That's awesome.
And once they come in, we ask for the diet, like, hey, are you drinking enough water? A lot of people not drinking water.
Yeah.
Just telling them, hey, did you drink water? Oh, let me drink water.
Simplest way to heal your body is to drink pure water, hopefully in a glass bottle, not plastic or filtered. It's very powerful.
It helps to flush
Hydration's
out.
huge. Yeah.
Yeah.
Well, think about it. Everything in the body has to come out as water. And you eat fat, whatever you put in your system, it has to be turned into water and come out as water.
Yeah.
You don't want fat coming out of your body.
Something is wrong with you then.
Well, you can tell. Like, I mean, it's gross, but you can tell if your stool floats, then your gallbladder isn't working very well.
Yes.
Because you're not
seen that.
Yeah, definitely. So, well, let me hear about what you do, because I know you're the quiet, bright one over there. Not that you're not. What do you do exactly? Tell me, like, what kind of patients do you see, and how would I refer to you?
So I'm mostly working with a lot of all different ages, and like my background's with sports medical massage.
Okay.
So I did stretch therapy, neuromuscular therapy, working with the trigger point.
It's like football players and monsters.
I used to
hurt
with
their muscles. And,
football players, athletes, Spartans.
On the field while they're playing, or
no, not in the field. So they go compete, they come back, they get they're stiff, or they're hurting, or they're preparing for a race, so they want to stay loose and prevent an injury.
Right.
So because that's really important. Like if you're training, especially like a lot of clients training for like Ironman, Spartan races.
Oh, wow.
They're training for a marathon.
Yeah.
So if you pull a muscle while you're training, you're not going to be able to compete. So keeping loose, keeping the fascia loose. So he was talking about fascia, which is almost like a wetsuit underneath your skin.
Okay,
it connects to you from the head to your toe. You can pull the fascia on the toe and it can make the head move. That's how you are interconnected, the whole fascial system. Keeping fascia loose, smooth, keeping that muscle like naturally, like you were saying, like tofu. That was a great example.
Yeah.
Because a lot of people come in, athletes, they come like stiff as a board.
Like,
And some people, I feel like I'm like massaging like stainless steel. And it's like, did you drink water today? Like, what's happening? Many people are dehydrated.
Well, we see that too because they don't drink water, then we can't do the IVs. It's like, hey, where's that vein? I saw it before. It's like completely gone. Like they hide from you.
And I'm sure it's probably hard to put the needle in too, because
well, you can't. If literally, like I have pretty big veins. If they're like that, you can go right in. But if the patient gets nervous or they're fine when they come in, and all of a sudden they see the needle, and all of a sudden, gone. Like veins just completely, because the adrenaline starts kicking in, and you can't get a vein if it's down there. It just will not work. Yeah. Well, it's really hard anyway. So
Have them do push-up. This is a hack. I started doing
we
this.
could, most of them, they're 50 to 70 years old, many are women, so it's not like they're going to want to do push-ups, but you can literally I should get a 5-pound weight, a pretty heavy weight, and just make them do bicep curls until they're like, I can't do it anymore. Okay, you're fine. We can get it in now.
Maybe we can wasabi them, get that circulation going.
Ooh.
Yeah.
All right.
Yeah, release that tissue. And then I've had clients tell me that, I had one lady tell me, because she was having numbness and tingling in her hand, and when I released...
Neuropathy?
It was more like TOS, thoracic outlet syndrome.
Okay.
So she was having nerve entrapment in her pec and down here. So like once I released the neck, the pec, all the scalenes and all those other tissue, she said, she's like, didn't know how to describe it. She's like, I don't have the numbness and tingling. I don't know what I guess this is what's supposed to feel like when you're not in pain.
Right. Oh, man.
I was like, and that was just like in one time,
That's so
because
cool.
she just had a nerve just stuck that comes down in here. Once you release it, then everything flows. And then she said she just felt like so much like blood and everything just flowing back into
Hand
her.
was hot and
Yeah.
warm again.
Yes.
That's great.
Yeah, a lot of times when you meet people who have cold hands and feet, it's a lack of circulation.
And you can do something about that?
Yes.
Just
so
really?
fascia work, wasabi to open up the fascia, release the tissue.
Red
light therapy, which will help increase circulation.
Oh, okay.
So I don't know if people are familiar with red light therapy, but red light therapy, the photons from the red light actually stimulate mitochondria inside the cells, and those cells have more energy.
Okay, so and then what happens when the cell has more energy?
Well, it's like I always tell my clients, it's like you're giving a cup of coffee to your cells. Okay. So now they're happy, they're awake. Now they can do work. They can help. They can do either detox. They can increase circulation. They have now energy to do stuff, where a lot of cells are just stagnant.
So do you think the wasabi helps get rid of senescent cells?
That I'm not familiar with. I don't know if you know anything about that.
Well, they're just cells that have been, the mitochondria have a lot of issues in their autoimmune, a lot of times too.
I think to a certain extent it does help, because if you're helping the body with so when you do wasabi, it helps you to turn on different cells to repair. Don't they eventually go to your system and helps you to feel better?
Well, yeah, it's maybe like stem cells almost. Probably stimulates stem cells.
Because wasabi does help you to activate the local stem cells.
Okay.
So if you're helping just local, I think it definitely go in different parts of the body, or it can eventually go to your the heart, or make them stronger, because most of the blood flow comes through.
But you can't go over the heart.
Not with wasabi.
No, not with wasabi.
It's not okay. Probably at the cardiologist if they even could do that. All right, this is really cool. So that's happened to me so many times, and usually I'll be the one. I have a Tesla, so it's a pretty good GPS, and I can't get anything. And my wife's over there like, just give me her phone. Here, just use this.
She's calm.
And she's like, no problem. It just goes perfectly.
So if we use vibroacoustic bed, it can help you to center yourself.
Right.
Because we have 42 different programs. Then I also have a therapy called PEMF.
Yeah, I've heard of that.
Pulse magnetic electrofrequency.
Right.
So they also charges your mitochondria or cells.
That's the one that really strong control.
Yeah.
It's like a bed you lie in.
Right.
Yeah, it can make your stomach like move, and almost weight loss you could probably do too, right, with that thing?
You can help a lot of people who has, let's say, some kind of neuropathy happening.
Oh, really?
Because the muscles need to be contracted, so the nerve gets some signals. And
what is the medium of that bed? What's the measure? What was it used? It's
pulse electromagnetic frequency.
Magnetic.
It's magnets. Yeah.
Okay.
So there's a really powerful magnet that can stimulate the electrical system of the body, and really good for moving lymph tissue and lymph, because most people don't know, like, your heart pumps blood but doesn't pump lymph fluid.
Yeah.
Well, the whole lymph system is different. I think we totally fail on this. Even a lot of doctors, even natural doctors, fail to clean the lymph. Yeah. And my analogy of this has always been, if the lymph isn't clean, so the blood is where all the criminals are, and the body takes the criminals out and put them in the lymph. But if you never even go to the jail, you don't help them anything. Well, what do? They burn down the jail. and that's literally like your lymph. And that's especially with cancer, that's so important because your lymph nodes, you can feel them, they're all swollen. And the ones in your arms don't really get swollen unless you have something really serious, usually breast or upper body. And then the ones in the inguinal area, same thing. And you'll have these when you're sick. But the other ones will swell huge if there's something really serious.
Yeah.
But they're swelling so they can do more work. But if you're all backed up, if you're like glowing with toxins, heavy metals, just eating poorly, McDonald's, whatever it is, and all of a sudden you get cancer and you don't actually try to clean the lymph out, I think this is where a lot of people die. Or they get really sick, and especially using chemoradiation, that's going to back it up even more. So your immune system's basically helpless, and you're at the mercy of the treatments of the doctors, which is, if you understand the immune system and how powerful it is, that's ludicrous to get in that situation. But that's what a lot of people are doing because they just don't know any better. And, it's hard for them, of course.
Also, spending time with the client helps me a lot to understand them. So my first couple of sessions usually are like hour 30, hour 20 minutes.
Oh, really? That long?
Because I want to know why they're here.
Talking or?
Talking, doing therapy. So when
Okay.
they're doing vibroacoustic bed,
That's
just
great.
trying to understand them, because a lot of my client that I get to see them, if you speak with them, they will give you answer, and we stop listening. So I listen to them, where they're coming from, what
Okay.
they're looking for. And some people for them to just leave the house twice a week, they look forward. And on the way, I usually tell them, hey, look for a good food place where you can go and spend time with yourself.
Yeah. Buy yourself roses kind of thing.
Yeah.
Take care of yourself.
So it changes their mindset that they matter somewhere.
And it's also like you say, and they'll be like, what? And they'll say, yeah, you can do that. It's allowed. Like, oh, really? Whoa, because most people are so hard on themselves. Just beat
And bring
themselves
some
up
extra
all day.
plate. Bring some extra plate.
Yeah.
And now monetary value is something else, but every week I have people bring me small gifts. Like it could be a cookie, it could be something symbolic. They thought about me when they went home. Hey, I was thinking about you and I want to give you this thing. It shows them that they can receive and they can give without any hesitation. And all those therapy, when they combine together and their mindset changes, their cells are getting a little bit stronger because, they're going to have a little bit upside down. But, I'm going to be there for them. And I text them, ask them, hey, everything is fine. How can I help you? Do you want to change your appointment? Because sometimes just changing the habit, if they're supposed to come Monday and Thursday, I will change on purposely Tuesday and
Oh, wow.
Friday.
You're doing all these psychological tricks you're doing. That's I never even thought of it. I mean, I don't know if I'd have time to do any of that or my staff would, but you're managing each person yourself. That's really personalized treatment.
I had somebody who was scheduling, but they wouldn't ask, how can we help? Just a simple question, how can I help? What are you looking for? Makes a big difference.
Yeah.
If you send somebody, hey, this is my website, this is this, without asking them, yeah, they will, pay for all the services you're offering. But imagine if you tell them, hey, let me find out what's good for you. Why don't you come in? They get to see, they get to have the environment. I have chi coils that helps you to just bring the energy really on the really mild flavor, I want to say.
Okay.
When they come in, they don't feel like, oh my God, this is like so cool. They're just sitting there and they feel, I feel something is very comfortable here. And then the lights, I usually keep them on the red light, on the low frequency, so they don't get stimulation. So my office is usually set up in a way, as soon as you come in, you don't get like bombarded with the white light.
Okay.
I have red light
That's
on,
good.
red light on, yellow light on, sometime off. And just doing certain things makes a small increment in their healing. And that's all I'm looking for. And when I educate them, what does it do and how can this help you, they go and tell their other friends. My friend, my doctor, my therapist told me this thing, what do you think? And then they help me to communicate better with their practitioners.
That's good. Yeah.
And that's how
really
we
good.
create a circuit between
You're not
each
trying to
other.
hit a home run. You're just trying to get it, one base here and this,
Yeah.
I think a lot of times I'm looking to hit a home run. That's interesting. I gotta think of
Yeah.
that more. That's good. When we do it in homeopathy, I have to do it because if you don't know your patient, you can't find a homeopathic remedy.
Yes.
And that's in depth talking and going back and forth. Where are they stuck? Where are you stuck in different areas? Is it the same thing? How does it manifest? What makes it better? What makes it worse? When you have all that, you can put it in the software and you can
Yeah.
find a very powerful medicine. Actually, I did it last night for the first time
Wow.
in like a year because the patient's very, very sick. And I was like, no way I'm going to treat this without homeopathy. And we think we got, anyway. So that's really cool. I think I got to start doing this more. It's therapy for me too.
I think this is why when we go to the events, we are usually the last people to clean up. Because once people feel a little bit better that they were stuck for 10, 20 years, 30 years, some of those people, they will come back and they're like, can you please do one more session? Then they will go back and tell other people.
Yeah.
And then we wind up
So it's
creating
all referral. Like you're all.
a lot of referral. Because the other companies at A4M, the first question they ask, are you practitioners? If you're not practitioners, they don't even serve you. Like, think about it. You are in pain.
You mean the public can't just go and use the machines there, like the red beds and all that? They won't let
No, the other shockwave therapy.
because they're trying to sell it to the doctors, wanting to buy
Only
it?
to the doctor.
Oh, I see.
But
Oh, yeah, the public wouldn't. Well, they could buy it, but they may not. Yeah.
they can because they're not medical license.
Oh, I see. Okay.
But imagine
I got
if
it.
you had an opening, hey, yeah, I can show you what this device do. Why don't you tell your practitioner?
Right.
They can have a sale.
sell it like that. Yeah.
But we have such an open door policy that sometime at one of the biohacking event, we started at 8 a.m. and we went to bed like 11:30
Wow.
because we were treating all the speakers after the event and we were downstairs just helping. But they all needed some kind of treatment. By providing value to them, they always remember us. Whenever we see them at the event, we made a bond with them. Like,
Cool.
thank you for helping us. That's what we are looking for. Creating a circle when if you need something, you can call me up and I'll come for you. I'll take care of you. You call him. Like, I want to have a circle because as a society, we need to move forward. Individual stuff is not helping anymore.
No, you can't be selfish. This is so great what you're talking about.
Yeah.
I never even put it into words. I mean, network with people, this and that, but never had what is it? An affirmation to do that thing specifically. I mean, I do it naturally, but that's really interesting.
But now imagine if we all sitting here and you have Qigong practice happening, we will raise more vibration than you by sitting yourself.
Well, yeah, Falun Gong, that's what he's talking about, the Qigong that I do, and he's tried it before. And we know when we practice, especially even outside, the energy's stronger.
Yeah.
And then with more people, oh my goodness, you do the second exercise, it feels like your head's going to blow off. It's so much power. I mean, it's so much energy. It's incredible.
It becomes exponential because
Yeah,
there's
no,
like a
it really does.
synergistic effect.
It's
So
so
rather than
huge.
individual, just you only have so much, but when you have together, you increase
It
that
really
power.
makes a difference. This has been really amazing.
Thank you.
I'm so glad you guys came today.
Thank you.
Yeah, so listen, let's get together soon.
Yes,
I'll come
we
to
will.
Manhattan and I'll come to Torrance. All right, get out of my little niche. But you guys are doing really what you're doing is it's beautiful to hear this that there's people out there like this, especially
Yeah.
in the society now. Where it's kind of doggy dog and it's very
Yeah.
selfish. And I know for you, anytime I ever call you, you're just whatever you need. I'll come to New Jersey, help your mom. I'm like, really? Oh, I gotta pay you something. I gotta compensate for this.
No, we don't
You're
charge
just
each
such
other.
a nice guy.
Yeah.
So it's like Apple when they have those commercials and they said everybody knows how to do it
Yeah.
and everybody knows what they're doing, but they
Yeah.
don't know why they're doing it. And
Yeah.
Apple is like the only one. You
Yeah.
know?
Yeah.
So it's like that.
Right.
Okay, cool.
Thank you. Thank you.
All right.